Hello, my name is Melanie, and I want to talk to you tonight about depression in the elderly. A lot of people think that this is a normal part of aging, and it really isn't. Although research shows nearly 1 in 5 Americans over the age of 65 struggles with depression. Many times depression in elderly is underdiagnosed and often misdiagnosed. This happens for several reasons, but before we get into that, let's go over the symptoms of depression. The signs and symptoms of depression include social withdrawal, changes in appetite, unexplained weight loss or gain, lack of attention to personal care, sleep disturbances, loss of interest in normally pleasurable activities, and feeling of discouragement and general hopelessness. If you see anybody with these symptoms that last for more than 6 weeks at a time, it is time to have a discussion with the doctor. The causes of depression vary from person to person, but for the elderly they can include social isolation due to deteriorating physical and mental abilities, use of assisted devices such as wheelchairs, canes, and walkers make it harder for the elderly to get around, and so they become more socially isolated, and that adds to depression. Grief due to loss of spouse and close friends and relatives is another cause of depression. As we age, those around us who may not be in as good health as we are start to pass on, and that leaves a lot of elderly family members the only one left, and that contributes to depression. In addition, medications being taken for chronic illnesses such as Parkinson's disease, Alzheimer's disease, and strokes can produce the effects of depression. But what do you do when the medication that is solving the pain issues and other symptoms of Parkinson's disease is causing the depression? You take the medication anyway. Research has shown a couple of facts that surprised me and about depression, which are more women are depressed than men. But this could be contributed to the fact that women generally outlive men. However, more men are likely to attempt and commit suicide than women, which could be due to the fact that men take their loss of independence harder than women, because among the elderly generation, there is a general sense that the man is supposed to take care of the woman and not the other way around. And in addition, men are more likely to commit suicide because they use more violent means of taking their lives, making the rate of completion higher for men than women. It is really vital to get a proper diagnosis if you or someone you know is elderly and depressed, and that should include a complete physical with blood work, because again, oftentimes depression can mimic dementia. So you could have a diagnosis of dementia and it could actually be depression. Or it could just be a simple vitamin deficiency. Lack of vitamin D can cause depressive symptoms. So it's really important to follow up with a doctor and get a proper diagnosis. It is important to remember that while we slow down physically as we age and mentally, that may be normal, but depression is not a normal part of aging, and letting it go undiagnosed for a longer period of time can have devastating effects on the person's quality of life. So, in order to prevent depression, keeping a healthy diet, maintaining physical activity, taking your medication properly, and staying socially active is important. Also, having preventative factors like getting your family involved with your daily activities, asking them to call you once a week, staying in touch with friends that are left is a good way to prevent depression. And you're never too old to learn new things. So these are some of the things that can prevent depression. There are several risk factors that go with depression. If you have a family history of depression, it is important to talk to your doctor. I know among the older generation there is a stigma about getting psychotherapy or any kind of therapy, but therapy in combination with the medication taken for depression can vastly improve a person's quality of life. Thank you.